In this video, we're going to look at what the research is showing. Does massage actually help plantar fasciitis? Then we'll look at how this may help plantar fasciitis, and we'll look at what areas of the body you want to be targeting as treatment for it. Then finally, I'll demonstrate three massage techniques for your plantar fascia, depending on how sensitive it is, and also some massage techniques for the other areas of the body that you may find useful. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of your injuries. Have a look at the description of this video if you want a link to our website. What does the research show? Does massage actually help plantar fasciitis recover? There is some evidence to support that. There's not a lot of studies that's looked at this yet, so this is not strong evidence, but there is some evidence that if you add in massage as part of a holistic treatment plan for plantar fasciitis, those patients seem to recover more quickly or better than people who don't get massage. Now, the good news is also you don't need somebody else to apply the massage to you, so you don't have to go to a therapist to have it done. Self-massage techniques does seem to be effective. The important thing is to understand when to do it and at what intensity to do the massage, that you don't actually make things worse. And I will talk about that when I demonstrate the exercises as well. Interestingly, what the researchers have shown is that massage seems to work better if it doesn't just target the plantar fascia itself, but if it involves all the muscles along the posterior chain of the leg. What's the posterior chain? It's just the muscles that run down the back. And we call them a chain because the glutes are connected to the hamstrings, your back of your thigh muscles, via fascia and that runs there. And these are in turn connected to your calf muscles, and the calf muscle to the plantar fascia via the Achilles tendon and some more fascia. So it seems if you add in massage for all of those parts, it works better than just massage for the plantar fascia. So how does it work? How does massage actually help treat plantar fasciitis? Now, the first thing I will say is that I often hear people say that, oh, I'm breaking down the scar tissue with a massage. You don't have scar tissue in your foot when you have plantar fasciitis. Scar tissue forms when you tear something. When you have plantar fasciitis, you've not torn anything. With plantar fasciitis, it shows a thickening on the scans because there's more fluid accumulated in it. There's no scar tissue to break down. So that's not what you're doing. And don't think of trying to break down scar tissue, because it often leads people to doing massage way too hard and then causing their pain to increase. What researchers think is happening is that it's either, we know that massage has got very good effect on calming pain down because it reduces the sensitivity of the sensors in that area. Now, we've got lots of sensors in our body, and when you have an injury somewhere, those little sensors start to send more and more and more messages more quickly to the brain about stretch and pressure and all sorts of chemicals, because it wants to be on high alert and protect you. Now, what massage does, it's kind of like just stroking the head of the sensors and saying to them, calm down, it's not that bad, you're creating way more signals than what you should. Just come back to your normal levels that's appropriate for this injury. And what happens is, for several hours after the massage, if you do it at the right level and not too painful, your pain can decrease because those sensors are more relaxed or calmed down. But then this effect is short-lived. So if you don't do any other things to help sort your foot pain out, the pain eventually returns and you need more massage. So that's why it's important that it's only part of the treatment plan. The other way that researchers think it may work is that because all of our muscles are connected at the back of the legs, if you have really tight glutes or really tight hamstrings, they think that this may increase the pull on the sensitive plantar fascia. And then because it's sensitive, normally it wouldn't be an issue, but because it's now sensitive, that can help to increase the discomfort. So they think that if you can release the tension in the muscles, that can then relieve some of the pain in the plantar fascia. But it's also the case that if you've had pain in your foot for a long time, it starts to sensitize all the sensors up the back of the leg as well, because that's just how the body works. If you have pain in this area for a long time, it gets better at creating more signals and things, and it goes up the leg eventually. So massage will also help to calm those sensors down all the way along the leg where they're too sensitive and they shouldn't really be firing off like that, and just get that pain to dull down. So it's a really useful thing to do for short-term pain relief, but if you want to get rid of it in the long term, you've also got to look at other treatments, and I've explained those in a different video. So have a look at the description of this video if you want to know about all the treatments for plantar fasciitis. I'm going to demonstrate 3 types of plantar fascia massage for you. And there isn't a thing of this one's better than that one. It just depends on what suits you. So I'll start with the one that suits most people, that has quite sensitive plantar fascia. And that's quite useful because you don't need any extra tools for it. And then I'll show you 2 more techniques that you need other tools for, but that you can easily get over the internet. And I'll also put links to those in the description of this video if you want to get examples of what you can find on Amazon for them. The first massage technique that I'm going to show you is actually my favorite because you can do it anywhere without any equipment, and it's brilliant to do first thing in the morning before you get going. Now, if you've got plantar fasciitis, you'll likely know that the first few steps early in the morning is the most uncomfortable. And there are rumors running around that it's because, if you put your foot down, you're re-tearing the plantar fascia because it's so sore. That's nonsense, by the way. What happens is, when you have an injury like this, during the night, when you're lying still, there's less circulation. So now all the fluid and the chemicals that's being produced through the injury accumulates in that area. So it swells a little bit, and those chemicals create extra pain, so it becomes super sensitive. So now as you put your foot down, it's like, oh man, this feels really uncomfortable. But then as you move around, the discomfort goes away because the circulation improves and all of that is taken away, so now it feels more comfortable. So you're not re-tearing anything, it's just that fluid accumulation. So if you can help that extra fluid and the chemicals to dissipate before you get going, you'll feel a lot more comfortable. So imagine you're sitting on your bed, but obviously anywhere else when you're doing it through the day. And all you want to do is you can have your foot out in front of you. You can have your foot like this. This is most comfortable for me. So you can combine this with a stretch as well, and I'll show that to you. But the first thing we do is we just want to start rubbing the foot. Now, often people will ask me, what direction do I need to rub it? What's going on? To be honest, it's the pressure that's comfortable that you're putting with your thumb on there that makes the difference. You don't have to stress too much about how you rub it. You can use cream on it if you want to make it more slippery, but I find it's useful just without cream as well. Let me turn this way that you can see what I'm doing. So the most sensitive part is usually where it attaches to the heel there. And you don't have to go hammer into that at this point. I'm just gently saying to everything, hello, how are you this morning? How do you feel? Let's just get this foot used to, we're gonna get going now. Now, you do that for however long you feel is comfortable for you, 30 seconds, even a minute if you like, because that will help the circulation. And I am just pushing it around. I'm not doing anything fancy. This is more than enough to do. It's natural to feel that it's really sensitive in this area, for instance, because there's not a lot of meat between your fingers and the bones. So you will find if you press too hard in certain areas, you may get tingling sensations, you get sharp pains, and that's just because you're squashing your little nerves and things against your bones. So be gentle. Don't go squashing things too hard, and if you feel those things, it means you need to ease off it. It's normal to feel that. If I'm going to squash my foot too hard, I'll feel the same things. Now, what you can do is you can also bend your foot slightly back while then doing that, because that puts a little bit more stretch on it, so it's a stronger massage. And you can even bring your toes back while you're doing that, and it makes it a stronger massage. But this is only if your plantar fascia is happy with that. I would just start with doing exactly this. I'm doing little circular movements with my thumbs because that's comfortable for myself, and I'm moving on as I go along. The second technique to massage the plantar fascia uses a small ball. You can use a tennis ball or a big lacrosse ball as well. It's just not going to give you that good a massage because it's a little bit big, but if your plantar fascia is quite sensitive, it may be a good place to start. I've got a ping pong ball or table tennis ball at the moment. It's not ideal because it's too soft, but it's the only thing I could get because I'm traveling at the moment. So ideally, you want a firm rubber ball. A golf ball can work, but a golf ball is really hard, so just don't press too hard then. But what we're looking to do, I'm going to show you this way first. is we're just looking to roll the ball up and down along the foot. So like that. Okay. And you can hold it for several seconds in one position and roll it side to side as well. But that I would leave for when your plantar fascia is less sensitive. So a good way to start is just forwards and backwards to start with, and later on we'll do point pressure. Now, let's see. I'm going to put it there for you. This is my foot that's injured, and it's literally just rolling it forwards and backwards. I'm not squashing my foot down as hard as I can, because remember, I mentioned before that your little nerves run under your foot as well, and there's not a lot of cushioning. So if you're going to go and really squash it down hard, that's going to irritate your nerves. And I had a patient before who was really desperate to get better, and she did it so hard with a golf ball that she ended up injuring her nerve. And in the end, the nerve took several months longer than the plantar fascia to get better. So honestly, don't be too aggressive with it. Just have it that it's comfortably uncomfortable or totally comfortable. That's absolutely fine. And you want to do it for about 1 to 2 minutes. Now, if that's fine, you can go into more sensitive spots and just maintain the pressure on that. Now, I'm again not pressing as hard as I can. I can feel this is comfortable. I can feel some pressure, but I can feel the pain slowly dissipating as I go. And you just hold it for about 20 to 30 seconds, and then you move it on to the next spot. But whenever you do something new in your treatment plan, you always try a little bit first. So you try the simplest thing, check how it reacts in 24 hours afterwards, and then you add a little bit more if you felt that it was okay. These type of exercises, you can do them daily, and it often helps if you do the plantar fasciitis massage type things on a daily basis. You can get better results pain-wise, because remember, the pain numbing effect only usually lasts for a few hours. So you can even do it twice a day, but I'll show you my favorite one for in the evenings when you get home and your foot feels really uncomfortable. Okay, so if you come home in the evening and your foot feels really uncomfortable, having a bottle of water that's frozen can be so good to massage it with, because the coolness will also help to numb the pain a little bit. Now, my bottle has gone and flattened when it froze, so I think you may want to put more water into it that it doesn't happen, but this bit is still okay, so we're going to use this bit to massage it. You follow the same regime really, and if you don't have a cold bottle like this, I know on Amazon you can sometimes get those little rollers. They can work as well, and you can even get those rollers that you can put water in that it acts like an ice bottle. So have a look at what you can find that's the most comfortable for you. Now, you can just rest your foot to start with on it like that and just be gentle with it and just get the pain to calm down a bit. Or you can take it onto the edge where there's a little bit more of a rounding that you can get more of a massage effect. The main reason I would apply it to this is to just help decrease your pain. You're not going to influence the healing, you're not going to influence inflammation or anything like that. You just want to do it for about 10 minutes at a time. Cooling tissue too dramatically for too long can actually be not good for your injury. So don't go overboard with it, but that counts for anything you do. There's always like a sweet spot of what you want to be doing. Of course, a few minutes this side or that side doesn't matter, but if you really overdo it and sit with it for half an hour, then we're starting to get into the territory of, is that really useful? Okay, so to foam roll your hamstrings, we're going to use two techniques. We're going to do long, smooth strokes, and we're also going to do point pressure, for which I tend to use a ball. Oh, because I'm traveling at the moment, I don't have all the things I used to have with me, but you get these little blocks, they're called well bricks, and they've got a bump like a tennis ball in them, but because they're a block and they're rubber, they don't move, and they're so handy for this. But tennis ball will do if you don't have anything like that. So let's start with the broad, smooth rolls. Now, thinking about the anatomy of it all, your belly of your hamstring muscle is muscles, remember they're four muscles really, is at the back in the middle there. Then two tendons come around here and attach, two tendons there. Don't go and roll the tendon bit, because it's literally just tendon and bone in that area, and all you'll do is bruise it. Foam rolling is mainly for muscle bits, okay? Then all four hamstrings attaches right onto the sit bone. Again, don't hammer the sit bone. You can go quite quite close to it and right in, against it, but don't go and really grind the sit bone itself. You'll just make it sensitive. I'm not very strong in my upper body, so I tend to like to use my other leg to guide myself. You could do both legs at the same time on it and roll. I just don't find it that effective. So I tend to start with just going down the middle. So having the leg up there and just doing nice broad strokes. And you'll notice that I kind of knead a little bit and then I move on to the next bit. There's really no rules for this. Now once I've done a bit of that straight down the middle, I angle my leg, so I'm turning it halfway out. So that I'm getting the hamstrings that run on the outside of the leg more. And you'll even start feeling what feels like the IT band in this. And that's because your lateral quad comes and attaches quite round to that side. And there's a bit more fascia, so it's a bit more uncomfortable. So you just move it along as you go along with it. And then you can angle the leg in again. Let me just start from here, otherwise I'm going to be out of the video soon. So now I'm turning my leg in and I'm getting the inner part of the medial hamstrings more. Also getting a little bit of my adductor muscles. And this is probably, if I do have tight adductors and it's towards the back of them, I tend to use this method to get them as well. There we go. So you can go up and down on that until you feel you've done enough for it. And of course do the other side as well. Now, if you've got a specific spot that's quite tender, that feels a bit like a trigger point, this works really well. I'm using a towel under it to stop the ball from going out from under me, so the towel holds onto it. If you've got a nice squishy mat, exercise mat, it works really well as well. Mine just crunches at the moment, so it's making a noise, so I've put it away. But yeah, this is going to work. So you literally go onto the spot that you feel is most tender and you just put your pressure through that you can hold it there. Now remember, if you ever get tingling down the leg or anything like that when you're doing anything for the hamstrings, that's usually a sign that you're annoying your sciatic nerve. You probably want to be stopping what you're doing there. So if you're getting tingling down your leg with that, just move a little bit, that you're not putting the pressure directly on the nerve, but rather on the hamstring muscle. And you want to hold that pressure for anything between 30 seconds to 60 seconds for a trigger point to kind of switch off. Now some people also find coming really high up, kind of nearly the sit bone, can be quite useful for them. But to be honest, I find that's more effective if you do it on a chair, that you're sitting on a chair that the leg's hanging down. You can get a bit more pressure through that. But remember, we're not going onto the sit bone, you're just going into the muscly bits close to the sit bone. Okay, so foam rolling the calves. I can't believe I've got to demonstrate this because I hate doing it because mine's so tender. So again, I use my opposite leg to help guide my movement, because if I try to do it both legs on there, my upper body just gets too tired and my shoulders actually hurt the next day. So I find it's more effective if I use my other leg to support me. Now, we're going to use broad strokes again. So we're going to go length of the muscle. We're going to go in the middle, angle it in, angle it out, and just work it top to bottom. You will usually find that the outside is more tender in general, but the inside has a tender spot kind of in the middle of the calf, in the middle of the leg there. And that's quite normal actually, most people have that. Again, your nerves run right down the center of the calf, so if you're getting tingling and stuff from what you're doing, you're probably just irritating a nerve, so get off it and be nice to it. Areas to watch out for. Calf comes quite high, but watch out for this bit because you've got loads of your hamstring tendons and coming into that as well. So you can massage quite high up, but just make sure you're not just squashing or bruising a tendon. And then for the Achilles tendon, yeah, you can go over it, but be gentle. Don't go and really, really squash it. Just be nice to it, really. If it's really uncomfortable, you're probably just bruising it. So we'll start with using the other leg to guide the movement, and I'm pressing down through that leg to get pressure on it. And then we're just moving up and down and coming down all the way. Because remember, your soleus muscle does attach to the lower portion of the Achilles, comes in there, so you can go onto that. Just adjust your pressure. If it's a deeper squishy bit that you're on, so there's more muscle, more fat, you can go a bit harder. If it's literally just a little bit of muscle, skin and bone, you want to go softer because you're probably just going to bruise it. And to be honest, I don't think it's a good idea to do it as so hard that you actually cause a bruise, because then it's counterproductive. It should be comfortably uncomfortable when you do this. That helps the muscles to relax better. Whew, and there's a nice tender spot there. Okay, so you'll do this until you feel it's adequate for you. You can also, after you've done it with your foot relaxed, you can also pull your toes towards you and do it that way to get a little bit more of a stretch effect with it. But then if you've got specific points you want to work on that you felt were specifically tender, tennis ball works well again. I've got mine on a towel to keep it in place. And for this, I tend to, if I find the tender spot and I find it hard that I'm not putting enough pressure through, I just rest my other leg on it. Woo! And that usually gives me enough pressure. Now remember, you're going for comfortably uncomfortable, so not getting sweats and tears in your eyes because it's that uncomfortable. And you want to hold it for anything between 30 to 60 seconds or until you feel the discomfort slowly goes away. And of course you can angle different parts of it again. You could even roll on the tennis ball itself. I just find it frustrating because I never get to control mine properly. But if you've got a rubber ball with a rubber surface and you're on a rubber mat, that tends to help that you can control it better. Okay, so to massage your own glutes, I tend to use a tennis ball because I find I can get into my glutes more easily. I don't really find a foam roller is effective for myself, but you can try whatever you want. What I will say is just be gentle with it, because remember, your sciatic nerve runs right in the middle of your buttock, so through or underneath the piriformis muscle. And if you're too aggressive with it, you can make the piriformis go into a spasm, and that can actually cause sciatic pain down your leg. So be gentle with it, okay? So there are two versions. The first is a little bit more aggressive and it's on the floor. And essentially, all you're gonna do is you're gonna aim to get, if you can feel your bone there, and then the top of the pelvic bone there, so hip bone that everybody calls, it's kind of in that area that you want to be in, the squishy bits. And literally you're gonna angle yourself that the ball is in there, and you're gonna lie into it and just relax into it, and then just move it onto different spots. I tend to not roll at the beginning because mine's always quite sensitive, but you could also just roll it along it. There's really no right or wrong with this type of thing because we've not really established what works better than anything else. So it's literally just that you do. And at this point, I can feel there's a tender spot, and I'll relax the leg that I'm on. I like to prop it up a bit and just angle my body that I get a bit more pressure through there. And then you can move around as you go. That bit's quite tender. So you just ease off a little bit. There we go. So you can hold that pressure for about 30 seconds or until you feel that it's calming down and going away. And then you can move on to the next bit and just put some pressure on there. And then once you've done that for a bit and you feel you've covered the whole glute area, everything that's tender, you can then roll it and put some weight through that. But yeah, I prefer to do the holds first and then the rolling bit, but you may want to do it the other way around. Now, if your glutes are really, really sensitive, you can do it against the wall. Let me just see if I fit into the picture. Yes, that's fine. I'm going to shift that away for now. So the leg that's by the wall is going to be relaxed. So I'm putting the ball in between the wall and my glute where I want to be on it. And this leg is pressing into the wall. This one's totally relaxed so that the ball can actually get into it. Because otherwise, if you contract this one as well, you can't really get into the glute. And it's exactly the same thing. I'm just guiding it with my hand, but I'm pushing into the wall at a pressure that's comfortable for me. And then you can just move around and roll it as well if you want to. Nice, slow, long strokes. But the whole time, I'm aiming for comfortably uncomfortable, not painful, and definitely not to the point where I get referral down the leg or where I feel I want to pull a face. Brilliant. Hope you found that useful. Now remember, if you would like more help with an injury, you're welcome to consult one of the team via video call. The link to our website is in the description of this video. Take care.